One of the biggest challenges facing people with osteoporosis is their increased risk for suffering a life-changing bone fracture. 1 out of every 2 women and 1 in 4 men age 50 and older will have an osteoporosis-related fracture in their lifetime, which could result in deformity, debilitation, chronic pain, or death.
My name is Richard Keim. I'm an internal medicine physician with a special interest in osteoporosis, and do run a osteoporosis fragility fracture clinic at Queen City in Spearfish, South Dakota. You look at a hip fracture, the numbers are terrible. 25% are dead within a year. So it's a very significant number. 50% probably end up in a nursing home for a time period, and 50% usually have a permanent disability.
Your physician can help determine your fracture risk by reviewing your medical history and recommending a bone mineral density test. This non-invasive scan examines your bone density and provides useful information for developing an appropriate fracture prevention plan.
There are ways to estimate their risk. It's based on large population studies, and part of that is on their bone density. Part of it is on additional risk factors that they may have, and that may be family history of a fracture, previous fracture, use of steroids, or use of other medications. And there is a program that you're able to put this in, and then it gives them an estimated risk for a fracture over a next 10-year time frame.
In addition to medication, there are a number of things you can do to help prevent a fracture. Simple changes to your lifestyle, such as quitting smoking, limiting alcohol consumption, and increasing calcium intake will lessen your risk. And there are things you can do in your own home to prevent a fall. Remove throw rugs and loose cords. Minimize clutter. Install non-skid tape to showers and baths. And use nightlights. Also, try to wear sturdy, rubber-soled shoes and clean up any spills immediately.
Fall prevention is huge, meaning if there are things that you can do in the house to prevent an individual from falling, which is the most common place for falls, they're less likely to have a hip fracture or any other fracture.
To help guide patients, Dr. Keim and his team at Queen City Regional Medical Clinic in Spearfish have developed a fall prevention and fracture clinic. This multidisciplinary program involves a team of medical professionals working together to give patients the best chance to prevent an osteoporosis-related fracture.
You know, we've designed it as a multidiscipline approach. We have involvement certainly from our bone density technicians, because not having a highly reliable reproducible test is a huge problem in this. So having our technician highly involved in what we do is very important. Nursing is involved. They do a lot of the education pieces. Risk reductions, they go over that. They go over fall protections or fall reduction. And compliance. Compliance is a huge issue in this treatment because you're treating them for years. So if somebody stops taking their medicine, doesn't tell anybody about it, it is a huge problem. It's estimated that over 50% of the people do not take their medicines correctly for osteoporosis.
To learn more about the Fall Prevention and Fracture Clinic, call 605-717-8595. For more information about osteoporosis and fall prevention, visit regionalhealth.com/osteoporosis.